Assalamu alaikum everyone. Do all of you know about what's antibiotics resistance and how much dangerous it? Yes. Today I will discuss about the most important topics about antibiotics resistance. Let's go and enjoy this video together. Please subscribe the channel who haven't done it yet. Thank you very much. Yes, today's topic is antibiotic resistance. That is too much important nowadays. Antibiotic resistance happens when germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. That means the germs are not killed and continue to grow. Infections caused by antibiotic resistant germs are difficult and sometimes impossible to treat. When did antibiotic resistance become a problem? Previous work had posited four eras of the history, especially in the United States, of the surfacing of attention to antibiotic resistance, characterized by ever increasing attention to the problem that between 1945 and 1963. Why is antibiotics resistance a problem? Antibiotic resistance happens when germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. That means the germs are not killed and continue to grow. Infections caused by antibiotic resistant germs are difficult and sometimes impossible to treat. Is antibiotic resistant an example of evolution? The evolution of antibiotic resistance is an amazingly simple example of adaptation by natural selection, and there is growing interest among evolutionary biologists in using evolutionary principles to help understand and combat the spread of resistance in pathogen populations. What are the four types of antibiotic resistance? Antimicrobial resistance mechanisms fall into four main categories. Number 1, limiting uptake of a drug. Number 2, modifying a drug target. Number 3, inactivating a drug. And number 4, active drug. What are the causes of antibiotic resistance in Bangladesh? Studies shows that low-income countries like Bangladesh are more affected by AMR because of the widespread misuse of antibiotics, non-human antibiotic use, poor quality of drugs, inadequate surveillance and factors associated with individual and national poverty, and indicators like poor healthcare and standards, malnutrition. Okay, what are the main causes of antibiotic resistance? The main cause of antibiotic resistance is antibiotic use. When we use antibiotics, some bacteria die, but resistant bacteria can survive and even multiply. The overuse of antibiotics makes resistant because more common. The more we use antibiotics, the more chances bacteria have to become resistant to them. Okay? Can you reverse antibiotic resistance? Antibiotic resistance can be reversed by the addition of resistance breakers. That means orange boxes, such as beta-lactamase inhibitors to prevent antibiotic degradation. Number 2, efflux pump inhibitors to allow the antibiotic to reach its target instead of being removed by the efflux pump. And number 3, OM permeabilities or OM permeabilizers. Common infections that don't require antibiotics. Some common infections that don't require antibiotics. Number 1, sinusitis. Many patients who develop nasal congestion, sinus pressure, a sinus headache, and a runny nose think that if they get a prescription for antibiotics, they will feel better faster. Number 2, bronchitis. Number 3, pediatric ear infections. And number 4, sore throats. How do you treat antibiotic resistance? Some of the ways you can help. Some of the ways you can be helped. Don't take an antibiotic for a virus. That's number 1. Don't take an antibiotic for a virus. Number 2, don't save an antibiotic for the next time you get sick. Number 3, take antibiotics exactly as prescribed. Don't skip doses. Complete your full course of treatment even if you are feeling better. And number 4, never take an antibiotic prescribed for someone else. What is an example of antibiotic resistance? Example of bacteria that are resistant to antibiotics include methicillin-resistant Staphylococcus aureus, penicillin-resistant Enterococcus, and multi-drug-resistant Mycobacterium tuberculosis, which is resistant to 2 tuberculosis drugs, isoniazid and rifampicin. Okay, how do you identify antibiotic resistance? The standard method for identifying drug resistance is to take a sample from a wound blood or urine. Okay, the standard method for identifying drug resistance is to take a sample from a wound, blood or urine and expose resident bacteria to various drugs. If the bacterial colony continues to divide and thrive despite the presence of a normally effective drug, it indicates the microbes are drug resistant. How do you treat antibiotic resistant? I have discussed already. So next topics. How do we prevent antibiotic resistant? There's many ways that drug resistant infections can be prevented. Immunization, safe good preparation, hand washing and using antibiotics as directed and only when necessary. In addition, preventing infections also prevents the spread of resistant bacteria. Is antibiotic resistance permanent? Dutch research has shown that the development of permanent resistance by bacteria and fungi against antibiotics cannot be prevented in the longer term. The only solution is to reduce the dependence on antibiotics by using these less. Who is most at the risk for antibiotic resistance? Who is at risk of antibiotic resistance or resistant infections? Everyone is at risk of antibiotic resistant infections. But those at the greater risk for antibiotic resistant infections are young children, cancer patients, and people over the age of 60. How did antibiotic resistance start? Antibiotic resistance evolves naturally via natural selection through random mutation, but it could also be engineered by applying an evolutionary stress on a population. Once such a gene is generated, bacteria can then transfer the genetic information in a horizontal fashion between individuals by plasmid exchange. So thank you very much. I hope you all are cleared by this all informations about antibiotic resistance. So have a good day or good night for everyone. Please subscribe the channel who haven't done yet, and please share these videos for everyone. Thank you very much. Bye for this moment. See you again with a new informative video. Thank you very much.